Welcome to our comprehensive guide on healthcare financing models. In this video, we'll explore how different countries fund their healthcare systems, why financing matters, and the impact these models have on access and quality of care. Whether you're a student, professional, or simply curious, understanding these models is crucial for grasping the bigger picture of global health. Let's start by defining what healthcare financing means and why it's a foundational aspect of any healthcare system. We'll then move on to examine the main types of financing models used around the world. Healthcare financing refers to the methods and mechanisms by which money is collected, pooled, and allocated to pay for health services. It's about who pays, how funds are gathered, and how resources are distributed. Financing models influence everything from who gets care to how much it costs and the quality of services provided. Understanding these basics set the stage for exploring the different systems in place globally. Next, we'll look at the three main models: the Beveridge model, the Bismarck model, and the National Health Insurance model. Beveridge model is one of the most well-known healthcare financing systems. Named after William Beveridge, this model is characterized by healthcare being provided and financed by the government through tax payments. In countries like the United Kingdom, Spain, and New Zealand, most hospitals and clinics are government-owned, and most healthcare workers are government employees. This model aims to provide universal coverage, ensuring everyone has access to care regardless of their ability to pay. Next, let's see how this model operates in practice. The Beveridge model: the government collects taxes from citizens and uses these funds to provide healthcare services. Patients typically do not pay directly for most services at the point of use. Instead, the government allocates resources to hospitals and clinics, which are usually publicly owned. This approach helps control costs and ensures that everyone can access necessary care. However, it may also lead to longer wait times for certain procedures. Now let's compare this with another popular model, the Bismarck model. Bismarck model, named after Otto von Bismarck, is another major healthcare financing system. It relies on insurance systems, usually financed jointly by employers and employees through payroll deductions. Unlike the Beveridge model, hospitals and doctors are often private, but the system is tightly regulated by the government to ensure everyone is covered. Countries like Germany, France, and Japan use this model. Let's dive deeper into how the Bismarck model operates and what makes it unique. The Bismarck model: both employers and employees contribute to health insurance funds known as sickness funds. These funds are used to pay for healthcare services provided by private hospitals and doctors. The government regulates the system to ensure that everyone, regardless of income, has access to care. Patients usually have a choice of providers, and the system emphasizes efficiency and quality. Next, we'll look at the National Health Insurance model, which combines elements of both Beveridge and Bismarck. National Health Insurance (NHI) model blends aspects of the Beveridge and Bismarck systems. In this model, healthcare providers are mostly private, but the government runs a single insurance program that everyone pays into. This system is found in countries like Canada, South Korea, and Taiwan. The government collects premiums and uses these funds to pay for healthcare services, aiming to provide universal coverage while controlling costs. Let's see how the NHI model functions in practice. The NHI model: the government acts as the sole insurer, collecting premiums from citizens and employers. Healthcare providers remain mostly private, but the government negotiates prices and pays for services. This approach helps keep administrative costs low and ensures everyone is covered. Patients have the freedom to choose their providers, and the system emphasizes equity and efficiency. Now let's explore the out-of-pocket model, which is common in many developing countries. Out-of-pocket model is prevalent in countries where there is little or no organized healthcare financing. In this system, individuals pay directly for healthcare services at the time they receive them. There is no pooling of funds or insurance coverage, which can lead to significant barriers to care, especially for the poor. Many developing nations rely on this model, resulting in unequal access and financial hardship for those who need care. Let's discuss the implications of this model. People must pay for healthcare out of their own pockets. Many may delay or avoid seeking care due to cost. This can lead to worse health outcomes and increased poverty, as families may have to sell assets or go into debt to afford treatment. The lack of risk pooling means there's little protection against catastrophic health expenses. Next, we'll compare the strengths and weaknesses of each model to understand their real-world impact. Let's compare how each financing model addresses coverage. The Beveridge, Bismarck, and NHI models all aim for universal coverage, ensuring everyone can access healthcare. In contrast, the out-of-pocket model often leaves large segments of the population without coverage, especially the poor and vulnerable. Universal coverage is a key goal for many health systems, as it promotes equity and better health outcomes. Next, we'll look at how costs are managed in each model. Cost control is another important aspect of healthcare financing. The Beveridge and NHI models use government negotiation and budgeting to keep costs in check. The Bismarck model relies on regulated competition among insurers. The out-of-pocket model, however, lacks mechanisms for cost control, often resulting in high expenses for individuals. Effective cost control helps ensure that healthcare systems remain sustainable and affordable for everyone. Next, we'll examine the role of quality in these models. Quality of care varies across financing models. In the Beveridge model, government oversight ensures standardization but may lead to wait times. The Bismarck model's competition among insurers and providers can drive quality improvements. The NHI model balances quality with cost control, while the out-of-pocket model often results in inconsistent quality due to lack of regulation. Ensuring high-quality care is a challenge for all systems. Next, let's discuss how these models handle innovation. Innovation is essential for improving healthcare delivery and outcomes. The Bismarck and NHI models often encourage innovation through competition and government investment. The Beveridge model can also foster innovation, especially in public health initiatives. However, the out-of-pocket model may limit innovation due to lack of funding and infrastructure. Balancing innovation with cost and access is a common challenge. Now, let's look at the role of private insurance in different systems. Private insurance plays different roles depending on the financing model. In the beverage and NHI models, private insurance often covers services not included in the public system, such as dental or vision care. In the Bismarck model, private insurance may supplement or compete with statutory funds. In out-of-pocket systems, private insurance is less common and often unaffordable. The presence of private insurance can affect access, quality, and equity. Next, we'll discuss the concept of risk pooling. Risk pooling is a key principle in healthcare financing. It involves spreading the financial risk of illness across a large group of people so that no individual bears the full cost of care. This is achieved through insurance or tax-based systems. Effective risk pooling protects individuals from catastrophic health expenses and promotes equity. Out-of-pocket systems lack risk pooling, leading to greater financial vulnerability. Next, let's explore how different models address equity. Equity means that everyone has a fair opportunity to access healthcare, regardless of income or social status. The Beveridge, Bismarck, and NHI models strive for equity through universal coverage and risk pooling. The out-of-pocket model, however, often leads to inequities as only those who can afford to pay receive care. Promoting equity is a central goal for many health systems. Next, we'll look at how these models are funded. Healthcare systems are funded through various sources, including taxes, insurance premiums, employer contributions, and out-of-pocket payments. The mix of funding sources affects the sustainability and equity of the system. For example, tax-based systems rely on government revenue, while insurance-based models depend on contributions from workers and employers. Out-of-pocket systems place the burden directly on individuals. Understanding funding sources helps explain the strengths and weaknesses of each model. Next, let's discuss the role of government. Governments play a central role in healthcare financing, especially in the Beveridge and NHI models. They collect taxes or premiums, allocate resources, and regulate providers to ensure quality and equity. In the Bismarck model, the government oversees insurance funds and sets standards. In out-of-pocket systems, government involvement is minimal. The extent of government participation shapes the accessibility and quality of healthcare. Next, we'll examine the impact on healthcare providers. Financing models influence how healthcare providers are paid and organized. In the Beveridge model, providers are often government employees. In the Bismarck and NHI models, providers are usually private but work within regulated frameworks. Payment methods can include salaries, fees for service, or capitation. These arrangements affect provider incentives, quality of care, and patient satisfaction. Next, let's look at how patients experience these systems. Patients' experiences vary depending on the financing model. In systems with universal coverage, patients generally have better access to care and face fewer financial barriers. In out-of-pocket systems, patients may delay or avoid care due to cost. Wait times, choice of providers, and quality of services also differ. Understanding patient experience helps highlight the real-world impact of financing decisions. Next, we'll discuss administrative efficiency. Administrative efficiency refers to how smoothly a healthcare system operates behind the scenes. The Beveridge and NHI models tend to have lower administrative costs due to centralized management. The Bismarck model's multiple insurers can increase complexity but also foster innovation. Out-of-pocket systems may lack coordination, leading to inefficiencies. Efficient administration helps reduce costs and improve patient care. Next, let's look at how these models respond to public health crises. Ability to respond to public health crises like pandemics depends on the financing model. Centralized systems such as Beveridge and NHI can mobilize resources quickly and coordinate responses. The Bismarck model relies on cooperation among insurers and providers. Out-of-pocket systems may struggle due to fragmented funding and limited resources. Effective crisis response is essential for protecting public health. Next, we'll discuss the challenge of rising healthcare costs. Healthcare costs are rising globally, putting pressure on all financing models. Aging populations, new technologies, and higher expectations drive up expenses. Governments and insurers must find ways to balance cost control with quality and access. Innovations like value-based care and preventive health programs are being explored. Managing costs is a constant challenge for policymakers. Next, let's look at the role of technology in healthcare financing. Technology is transforming healthcare financing by improving efficiency, reducing fraud, and enabling new payment models. Electronic health records, telemedicine, and data analytics help streamline processes and enhance transparency. These tools can support better decision-making and resource allocation. However, technology also requires investment and training. The impact of technology varies across financing models. Next, we'll discuss the importance of sustainability in healthcare financing. Sustainability means that a healthcare financing system can meet current needs without compromising future generations. This involves balancing costs, quality, and access over time. Tax-based and insurance-based models must adapt to demographic changes and economic pressures. Out-of-pocket systems are often unsustainable for the poor. Policymakers must plan for long-term stability. Next, let's look at how financing models affect health outcomes. Financing models have a direct impact on health outcomes. Universal coverage and risk pooling are associated with better population health, lower mortality rates, and higher life expectancy. Out-of-pocket systems often result in poorer outcomes due to barriers to care. The design of a financing system can determine how healthy a society is. Next, we'll explore the concept of catastrophic health expenditure. Catastrophic health expenditure occurs when healthcare costs are so high that they threaten a family's financial stability. This is more common in out-of-pocket systems, where there is no risk pooling or insurance. Universal coverage models help protect against such expenses by spreading the risk across the population. Reducing catastrophic expenditure is a key goal for many health systems. Next, let's look at the role of international aid in healthcare financing. International aid plays a significant role in supporting healthcare financing in low-income countries. Aid can come from governments, international organizations, or nonprofits. It helps fund essential services, build infrastructure, and respond to emergencies. However, reliance on aid can create challenges for sustainability and local ownership. Integrating aid with national financing strategies is important for long-term success. Next, we'll discuss the concept of universal health coverage. Universal health coverage (UHC) means that all people have access to the health services they need without suffering financial hardship. Achieving UHC is a major goal for many countries and is supported by the World Health Organization. Financing models that emphasize risk pooling and universal coverage are more likely to achieve UHC. Out-of-pocket systems make UHC difficult to attain. Next, let's look at examples of countries using different models. United Kingdom uses the Beveridge model, with the National Health Service (NHS) providing healthcare funded by taxes. The NHS offers comprehensive services to all residents free at the point of use. This model emphasizes equity and cost control but sometimes faces challenges like wait times. The UK's experience shows the strengths and trade-offs of a tax-funded system. Next, we'll look at Germany's Bismarck model. Germany's healthcare system is based on the Bismarck model, with statutory health insurance funds financed by employers and employees. The system provides universal coverage with a mix of public and private providers. Patients have a high degree of choice and the system is known for quality and efficiency. Germany's approach highlights the benefits of regulated competition. Next, let's examine Canada's national health insurance model. Canada uses the national health insurance model, with a single-payer system funded by taxes. Healthcare providers are mostly private, but the government pays for essential services. Canadians enjoy universal coverage and low administrative costs. However, some services like dental care may not be covered. Canada's experience demonstrates the strengths of a single-payer approach. Next, we'll look at a country with an out-of-pocket system. India's healthcare system relies heavily on out-of-pocket payments, with limited insurance coverage. Many people pay directly for services, leading to financial hardship and unequal access. The government is working to expand insurance and improve public health infrastructure. India's experience highlights the challenges of financing healthcare in low-resource settings. Next, we'll discuss recent trends in healthcare financing. Healthcare financing is evolving, with new trends like value-based care, public-private partnerships, and digital health solutions. Countries are experimenting with different models to improve efficiency, quality, and access. There is also a growing focus on preventive care and population health. These trends reflect the need for adaptable and sustainable financing systems. Next, let's look at the challenges facing healthcare financing today. Healthcare financing faces many challenges, including rising costs, aging populations, and disparities in access. Policymakers must balance competing priorities and make tough decisions about resource allocation. Ensuring sustainability, equity, and quality remains a constant struggle. Addressing these challenges requires innovation and collaboration. Next, we'll discuss the importance of stakeholder engagement. Engaging stakeholders, patients, providers, insurers, and policymakers is essential for effective healthcare financing. Stakeholder input helps ensure that systems meet the needs of the population and adapt to changing circumstances. Collaboration can lead to better policies and improved outcomes. Building consensus is often challenging but necessary for lasting reform. Next, let's look at the role of health economics. Health economics studies how resources are allocated in healthcare and the impact of different financing models. It provides tools for evaluating efficiency, equity, and effectiveness. Policymakers use economic analysis to design and improve financing systems. Understanding health economics is key to making informed decisions. Next, we'll discuss the importance of transparency in healthcare financing. Transparency means that information about healthcare financing is clear and accessible to all stakeholders. Transparent systems help build trust, reduce corruption, and improve accountability. Governments and insurers can use technology to share data and track spending. Transparency supports better decision-making and public confidence. Next, let's look at the future of healthcare financing. Future of healthcare financing will be shaped by demographic changes, technological advances, and evolving public expectations. Systems must become more adaptable, sustainable, and equitable. Innovations like digital health, personalized medicine, and new payment models will play a role. Policymakers must anticipate challenges and seize opportunities for improvement. Next, we'll summarize the key points covered in this video. We've explored the main healthcare financing models: Beveridge, Bismarck, National Health Insurance, and out-of-pocket. Each has strengths and weaknesses in terms of coverage, cost control, quality, and equity. Universal coverage and risk pooling are associated with better health outcomes. Challenges like rising costs and inequality remain, but innovation and stakeholder engagement offer hope for the future. Next, let's reflect on the importance of healthcare financing. Healthcare financing is a cornerstone of any health system. It determines who gets care, how much it costs, and the quality of services. Effective financing promotes equity, sustainability, and better health for all. Understanding these models helps us appreciate the complexity and importance of healthcare policy. As we move forward, ongoing reform and adaptation will be essential. Next, we'll offer some final thoughts. Healthcare financing is a complex and evolving field. No single model is perfect, and each country must find the approach that best fits its needs and values. By understanding the different models and their implications, we can work towards systems that are fair, efficient, and sustainable. Thank you for joining us on this journey through healthcare financing models. Stay informed and engaged as the world of healthcare continues to change. If you're interested in learning more about healthcare financing, there are many resources available. Academic articles, books, and reports from organizations like the World Health Organization and World Bank provide in-depth analysis. Online courses and webinars can also help deepen your understanding. Staying informed is key to engaging in meaningful discussions about healthcare policy and reform. Thank you for watching our video on healthcare financing models. We hope you found this overview helpful and informative. Understanding how healthcare is financed is essential for anyone interested in health policy, economics, or global health. Stay curious, keep learning, and continue exploring the fascinating world of healthcare systems. Until next time, take care and stay healthy.